this time, what we've really seen is from coast to coast to coast, we are all showing that we're all showing the world that, Canadians were united and Canadians will always have each other's back. Right now, we're really seeing what the Ontario spirit really entails, and that we are one province, one nation, one country. And you've really seen over the past few weeks the resiliency of everyday people and how they can help with a supportive, coordinated approach to take action. And you've really seen the supportive, coordinated approach with all levels of government, whether it's us at the provincial level, the federal level, municipalities. It's incredible how all of us have come together from the government side, but you've also seen businesses, you've seen first responders. At the end of the day, we're all in this together and we're all going to get out of it together. But my emphasis is really to send a message home to everyone who is watching, is that our health is in our hands, and it's the actions and decisions that each and every one of us take every day. We have personal responsibilities as citizens to invest in humanity. And right now, what humanity really needs is we need to all be vigilant. And, as much as we're working really hard around the clock to support our first responders as a province, and we're putting in all efforts, nothing's off the table, but we want to ensure that everyone who is at home or at their place of work, that they are taking the necessary precautions to be safe, wash your hands, execute social distancing when you're at grocery stores, and, help protect your children, your loved ones, check up on them. It's really important this time of this time in our period that we really rally together and support one another. While the office is closed for people to come in because we want to exercise caution and safe measures, we're certainly open for business when it comes to phone calls and emails. So myself and my staff have been working all around the clock to get back to constituents. So if people do want to call, they can call the office. Phone lines are always open at 705-722-0575. They can also email us at andrea.khanjin@pc.ola.org, or certainly reach out on other channels, social media. We're happy to help during this very important time to clarify any questions that people have, or direct them to the best resource. And we've been doing that every day since this started, and I'm just incredible to be supported by the community and by the staff I work with. So our government introduced legislation. We recalled the legislature during this epidemic in order to pass legislation that would protect workers. In Ontario, we have the Employment Standards Act, and it was very crucial for that act to be amended to respond to this time of an epidemic crisis. So essentially what it does is it ensures workers still have a job at the end of the day, that they will not lose their job or their place of employment. And that was very important because the act as it currently stood before the epidemic did not account for that and needed to be amended. We also, as part of protecting workers, we included in there, if you have to stay home because schools and daycares are closed and you have to take care of your children, if you have to stay home to take care of a grandparent or a loved one, then the legislation includes you, so you would not lose your job, essentially. So that was very important to take that measure very quickly. And so we were able to work with all members of government, both opposition and third-party independent members, all who supported this. And so it really shows you, no matter what your political stripe is, we're all in this together, and everyone passed this bill without any qualms and full support. So to date, to help those on the front line, the healthcare system, there's been a very large package of healthcare relief announced, about $304 million. That's going to things like our long-term care facilities, our public health units, our hospitals. It's going towards things like supplies. For instance, something I've heard a lot from by being on the phone and messaging with different workers on the front lines, be they paramedic, nurses, doctors, you name it. They need protective equipment. And so we've invested in more supplies. And when it comes to protective equipment, we've invested in securing more ventilators. And so it's very key for us to protect nurses on the front lines. We've certainly sent out a memo with the Ontario Chief Public Health Officer, letting those on the front lines know if they had been traveling or interacted with a loved one who had been traveling, they do need to self-isolate for 14 days to protect others. And of course, they're able to go back to work after that. But it was really important for us to get all the resources as soon as we could to frontline work, frontline staff, and to our hospitals. To alleviate what's happening at hospitals, we actually changed the OHIP billing rules so that doctors can bill by using more of their services over the phone. For instance, if you have certain symptoms, you're not sure if they're COVID-19 symptoms, instead of going out of your home, out of isolation, you can now call your doctor, and we had been able to legislate them to be able to do that now. In addition to that, we've opened up self-assessment centers. So the one in Barrie is on Huronia Road. So if you do need a self-assessment and you're experiencing and you're certain you're experiencing COVID-like symptoms, you've called the Telehealth Ontario line, then certainly go to the self-assessment center so that you can be triaged and then you can receive a swab if you were deemed to be needing one. But the emphasis really here is we put a lot of efforts for more nursing personnel, such as Telehealth Ontario. We've opened up more lines, and of course more nursing staff on those lines, so people can call from their home, and if they are uncertain and they have symptoms, they can call, and of course they can call their family doctor. If they don't have a family doctor, that's a big component of why we emphasize people to call telehealth and to go to the self-assessment centers, because we realize not everyone can pick up the phone and call their family doctor. So we've seen as our local community here around Barrie and around Simcoe County how resilient we can be when we work together. Neighbors checking up on neighbors, helping one another. It's been incredible to see people on social media if they need help with picking up groceries. There are people out there that are doing so, and I've had people proactively message me saying, Andrea, if there's people that are contacting their office that they in their need of help, please tell them to reach out to us. And so my office has been able to connect them. And that really shows you how great it is when people do remember, the humanity we have in our society, that we can help one another in times of need. And it's incredible to see how resilient our community can be. And we'll get through this, right? The health resources are there, more are coming. Our food supply chain is secure, and as long as we practice, a lot of the healthy precautions that we have to practice, like washing our hands, we can get through this.